to Hera Manade, Era Mariesu, Era Mariesu to Hera Manade, Era Mariesu.
Every 2 minutes, a woman dies from childbirth or its complications. More than 16 million women still live with HIV/AIDS, and many women around the world still do not have access to skilled care. The UCSF Department of Obstetrics and Gynecology is dedicated to improving the lives of families around the world, and we are starting with women.
Over 20 years, our department has focused on averting maternal mortality and improving women's health globally. We have multiple research and intervention initiatives that cut across 4 continents and over 10 countries. From HIV to cervical cancer, from preterm birth to safe delivery, we partner with individuals, universities, governments, and organizations to protect women and improve their lives.
The Family AIDS Care and Education Services has reached more than 250,000 women in Kenya in just over a decade. Founded by the Bixby Center of Reproductive Health and partnering with the Kenyan Ministry of Health, our program provides preventive and therapeutic services to women who have HIV. FACES currently supports more than 140 health facilities and healthcare delivery, and almost 200 medical students and residents from the U.S. and Kenyan institutions in research and training. This intervention integrates family planning and HIV services, making it possible for HIV-positive women to have HIV-negative babies.
People think that Africa and Asia have the worst health outcomes. But in fact, in the United States, we are currently facing as much of a problem in preterm birth as some of the poorest countries in the world.
The UCSF Preterm Birth Initiative is a research-driven effort that focuses on reducing the burden of preterm birth worldwide. We plan to explore causes, solutions, and prevention of preterm birth and reduce the morbidity and mortality from prematurity worldwide. With Kenya, Rwanda, and Uganda being the initial international focus, research is being carried out in Africa and California. Obstetric emergencies are responsible for some of the saddest and most preventable deaths of women during childbirth. Bleeding after delivery, known as postpartum hemorrhage, is the leading cause of these deaths. The Life Wrap, a non-pneumatic anti-shock garment scaled up by Suella Miller from UCSF, helps to stabilize women in low-resource settings until they can get needed medical care. This simple device can be applied by anyone after a short, simple training. The Life Wrap is currently being used in 33 countries with great success. There are many causes of death surrounding delivery, including seizures and fetal distress. Pronto International uses low-tech, realistic simulation training to enhance provider capabilities to respond to obstetric and neonatal emergencies. Today, the program has trained over 3,000 providers in 7 low-resource countries. UCSF conducts research of cervical cancer screenings in Kenya and Uganda. We are conducting fistula reintegration studies in Uganda. UCSF has sponsored a collaboration with Moi University in Kenya to train the first gynecologic oncologist in all of Uganda. UCSF helps to educate clinician learners on facility and patient-centric challenges in low-resource environments through the Clinical Care and Low-Resource Settings curriculum. In 4 modules, with readings, video, and self-assessment, our multimedia curriculum emphasizes cultural and socioeconomic sensitivity and helps the health worker deal with the entire patient experience in these settings.
Education is a powerful tool that can solve the problem of sustainability in many settings. The UCSF OBGYN department supports several research fellowships like the University of California Global Health Institute GloCal Health Fellowship and Preterm Birth Initiative Fellows. In addition, we have several clinical fellowships, including senior scholars with global partners in anesthesia and surgery in Uganda, and the multidisciplinary fellowship called the HEAL Initiative, which is in conjunction with the Indian Health Services locally and multiple international locations. We also support fellows to get training in advanced care for women, including gynecologic oncology in Uganda, and skills like laparoscopy. Our OBGYN residents travel to Makerere University in Kampala, Uganda, to work alongside the Ugandan residents and understand and experience the global disparities in women's healthcare delivery. The UCSF OBGYN faculty are on the ground for clinical support, research collaboration, and skills transfer with our Ugandan colleagues. We're hopeful that our work in caring for vulnerable women in the U.S. and abroad is making an impact in women's health globally.
I believe change comes slowly and change can be adopted the way then it becomes a routine now.
Join us in changing women's lives globally. Together, we can make a difference.